Good morning. This is Dr. Rajesh Mehra from Chantilly Family Practice in Chantilly, Virginia, discussing with you some health tips. We've started a series on women's health. Last week, we discussed the importance of getting a pap smear. This week, I want to discuss breast exams and mammograms. All women after the age of 35 should have a mammogram done. The recommendations are that between the ages of 35 and 40, you need to get at least one mammogram done. Between the ages of 40 and 50, you need to get one mammogram every other year. And after the age of 50, you need a mammogram every year. What is a mammogram? A mammogram is simply a very fine X-ray of the breast. It picks up cancer, cysts, and other problems in the breast so they can be addressed quickly. Now, breast cancer is a very common problem in our society. The reasons, the causes of breast cancer are still unknown. Of course, having a family history of breast cancer should put you on alert more than not, but naturally, even if there is no family history of breast cancer, it can happen. You're not necessarily going to feel a lump. It may just happen. Of course, it's very advisable that once a month, every woman examine her own breast in and around the time or after the period, so you know what lumps are normal and what are not. And if you do feel something that is abnormal, to bring it to your doctor's attention. The whole topic of breast cancer is very difficult to cover in the next 1 or 2 minutes. Suffice it to say that, like all cancers, if it is found early, it is easily treatable by surgery and other methods. If it's advanced and spreads to other parts of the body, then it becomes very difficult to treat and it causes a lot of other side effects. So despite the fact that there are no symptoms, seek proper care in your age group and proper exams. Consult with your primary care doctor regarding the need and the importance of mammograms. Have a good weekend. Good morning. This is Dr. Rajesh Mehra from Chantilly Family Practice in Chantilly, Virginia, bringing you some important health tips. We've been discussing women's health, and today I want to discuss menopause. Menopause is defined by when a woman stops her period. This happens to all women. The time and the age is a bit different depending on family history and other factors. Mostly happens between the ages of 45 and 55, mainly around 50. The symptoms of menopause are hot flashes, irritability, could have a difference in sleep patterns, and also a change in dietary patterns and weight gain. Why does menopause occur in women? Most of the life, every woman has a period, and this happens because of complex hormonal things that go on month after month, year after year. At a certain time in a woman's life, these endocrine or hormonal changes stop occurring, periods stop, and menopause occurs. The symptoms are directly related to the fact that these hormones are not released or secreted in the body as they had been in the earlier part of the woman's life. So can menopause be treated? Well, this is a very controversial topic, as you may have heard. At one time, we gave all women outside or exogenous hormones to take care of these symptoms and these problems. In the last few years, this has been pretty much stopped because of the fact it was found that women that take outside hormones have some increased chances of breast and uterine cancer. My recommendation for people and women that are going through menopause is to seek medical advice and get some other kind of medication if the symptoms are interfering with your daily life. There are also herbal and alternative methods that you should explore that may work in yourself without doing any harm. So understand what menopause is. Unfortunately, it's part of life, but if the symptoms are severe, seek attention and advice to make symptoms better. Take care.